Look, her stomach's been hurting her for a few days now, but an hour ago, everything just went haywire. She's been screaming in pain. She gets really confused.
Abdominal pelvic ultrasound?
On it.
Okay, Allison, can you tell me exactly where it hurts?
I just got braces put on last week.
See the confusion, and her eyes, she can't even focus.
It's called nystagmus. Is she taking any drugs?
No.
Has Allison started menstruating?
I don't know, maybe.
Is she sexually active? Could she be pregnant?
She's only 13. Look, I don't think so. I'm just a stepdad.
Allie, baby. I'm sorry, I came as fast as I could. Baby, what's happening? I don't understand. She said she was feeling better when I left for work.
I'm not seeing any free fluids, no ovarian abnormalities. Now let's do CBC, CMP, chest x-ray, cultures, head CT, tox screen, blood and urine, and a serum pregnancy.
Oh, wait, pregnancy? What? No, Allie is still a virgin. She hasn't even started talking about boys yet.
I understand, but these are standard tests. We just need to run them to be safe, okay?
Can you just give her something for the pain, please?
I'm sorry, but we can't do that until the tests are finished.
Baby, what's going on, huh?
Wait for me!
We will figure this out, okay?
Okay,
I'll be back shortly.
Can you update me on Allison?
White count's moderately elevated, but her fever's rising and she's disinhibited with a decreased level of consciousness.
A drug overdose?
Tox screen was negative, as was every other test. Pregnancy, urinalysis, chest x-ray, CT, pelvic ultrasound.
Neurologic infection. Meningitis, encephalitis, you get an LP?
Just did. CSF was clear. Whatever this is, it's viral. The lab's running a PCR.
Okay, keep me posted.
Hey, Doris told me you matched in emergency medicine. It's awesome.
Way to go, Clark. Good to have you.
Thanks. Hey, there is something I've been meaning to talk to you.
Natalie!
Seizing!
Oh my God, make it stop.
To a Ativan.
Got it. Stats are dropping. 77, 76.
Allison, can you feel this?
I need to intubate. No drugs? Her jaw's loose.
I'm gonna fix this.
Okay, almost. Yep.
No, you're
Listen.
gonna choke her.
She won't be able to breathe otherwise.
I'm in.
Okay, I got it.
Secure the tube and start bagging. Stat chest x-ray and call up to the pediatric ICU for a bed.
Wait, I see what's going on with her.
Hey.
Allison's LP results. Encephalitis.
Oh my God, HSE?
Yeah, fever, neuro issues, seizures, now the coma. Virus fits the symptoms.
Yeah. I just didn't see it coming. I mean, she's 13. Herpes?
Allison has HSV type 2, which is more commonly associated with genital herpes than oral.
Genital? No. Allie doesn't do that. And when, where? She's either at school or at home with one of us, right, Kevin?
Yeah, look, I work from home. Nothing's going on at the house. Okay, no boys come over ever.
I know girls don't tell their mothers everything. God knows I didn't, but Allie and me, we talk.
Have you noticed any change in Allison's mood or personality in the last few days?
No. Besides being sick, she's been her usual happy self. Why?
Allison's abdominal pain is inconsistent with the HSE diagnosis, and it may be a sign of sexual assault.
We'd like to perform a more extensive pelvic exam just to be sure.
Is that really necessary? I mean, come on, it's not gonna have any effect on how you treat her, is it?
There may be some internal damaging and bleeding that needs to be repaired, and it is possible she may have contracted another STD.
Look, can it just wait? Can we wait until we just have a moment to figure out?
It's okay. It's okay. You can perform the exam.
Are you sure?
Yeah. If this is that, I need to know. I'm sorry.
Look, baby.
We'll get started right away. Allison's pelvic exam yielded evidence of vaginal trauma, perforated hymen, mucosal tear, severe edema, swelling, all clear evidence of sexual assault.
Timeline?
Yeah, the status of the bruising indicates the trauma took place about 5 to 7 days ago, consistent with the incubation period of the encephalitis.
Poor baby. All right, I'll activate the rape protocols and notify PD. This case is now a crime.
We'll talk to the parents about what comes next.
All right.
Thanks, Ms. Cohen.
The trauma nurse won't let me be in there with her.
It's protocol. Just while they're collecting evidence. It won't be long, though.
I'm gonna go get a cup of coffee. You want one?
No. Wait, can I ask you something, Dr. Manning?
Of course.
Could you be having unprotected sex regularly with someone with herpes and not catch it? Not even be aware that they have it?
Yes.
I don't want to believe it could be true, but the only person who was alone with Allie in the past week was Kevin. I can't think of anyone else it might have been.
Miss Nicholson, you can be with your daughter now.
Thank you. I'm just being paranoid, right?
I suppose I can't talk to the girl for some time.
No. The mom thinks his stepdad might have done it.
Wouldn't surprise me. That's where I was going to start. I spoke to the parents together and independently.
And?
I don't like the stepdad for the guy. He offered to give a polygraph and submit his DNA. Offenders don't usually behave that way.
Any other leads?
Allison's comprehensive tox screen detected trace amounts of triazolam in her blood. That's a benzo, right?
Yeah, a sedative hypnotic with amnestic properties.
The stepdad's an accountant. I don't see him getting his hands on that.
Well, unless maybe he's prescribed it. I mean, it is sometimes used for insomnia.
Yeah, it definitely puts you out. The hospital uses it mostly to treat patient anxiety, usually before procedures, MRI scans, things like that.
Yeah, so she could have gotten it here. Did you give it to her before the CT scan?
No.
No.
Another doctor then, maybe. Did the mom mention any other recent medical issues?
No, nothing. Other than the symptoms that brought her in today. Braces. Allison did just get her braces on.
Dentists also sometimes use triazolam.
Doctor? Doctor?
What is it?
She's awake. She's awake.
Breathing trial looks good.
I'm gonna take this tube out, okay, Allison?
All right. Ready? It's okay. Breathe. Yeah. There you go. Okay.
Where am I? You got sick, honey. We had to take you to the hospital. How long am I gonna be here? I don't want to miss the school dance. Oh, sweetie. Hi, baby. Oh, the orthodontist. I was in the waiting room the whole time just checking my emails. When she came out, she smiled, showed me her braces didn't seem any different.
The police suspect instead of nitrous, he used triazolam. It knocked her out, ensured she had no memory of the assault.
Sick bastard.
I know this is a lot to process. But once Allison is stronger, the detective would like to come in and ask her a few questions.
Look, Allie just had a brush with death, and all she cares about is if she can still go to the junior high dance. She's so innocent. I don't want to take that from her. One day we'll have to, but not today.
We understand. We'll be back in the morning to check on her.
This is what I get for trying to take on a 12-pound pot roast.
Good news is it's just a second-degree burn. Might blister and swell a bit, but you'll live to cook another day.
BP's 160/90.
Let's page OB, have him take a look. You're, 7 months along?
Yeah, why?
Are you okay?
Oh, everything's okay.
Your wife's blood pressure is slightly elevated. I'd like to get some labs and an ultrasound just as a precaution.
Is that necessary? I've been seeing my doula regularly, and she says everything's good. I'm right on track for home birth.
I know. You must think we're some granola-fed hipsters, but that's not it.
My sister miscarried after an amnio, and I promised myself I would do everything as natural as possible. And that includes protecting my baby from the harmful sound waves.
I understand completely. But in some cases, high blood pressure can affect fetal growth. I just want to rule out any possible complications.
Well, I guess it's good to be on the safe side. Right, honey?
Actually, totally my fault. Overdid it on the PT. Had to do that last leg lift, and this is my reward. Am I boring you, Doctor?
Oh, no, sorry. I stayed up all night attacking the library, got all the way to Bowlby.
Bowlby? Great stuff. Made Charles Darwin the fascination of an entire generation of shrinks.
Bowlby said that Darwin had a panic disorder.
Oh, yes, ma'am. Charlie had a dark side. Wait till you get to Barloon and Noyes.
Dr. Charles, Dr. Reese, thanks for coming down.
What's up, Ethan? What you got?
Amanda Kendrick Dobbs, 7 months pregnant, gravid belly, history of fetal movement and Braxton Hicks contractions, all signs of a normal pregnancy.
So what's the issue?
There's no baby.
Appreciate the visit, but we just want to make sure the baby's okay. Why are you here again?
Oh, we try and look in on all our expectant mothers as part of a routine wellness assessment. It was actually Dr. Reese who flagged your high blood pressure.
Yeah, have you been under any stress lately? Maybe something at work?
Oh, I'm not working. I haven't been since we moved here last year.
Yeah, when my firm transferred me from Denver, we thought it'd be a good time for Amanda to stay at home, focus on the baby.
Where did you say Dr. Choi was again?
We're pretty sure he's just waiting for the rest of your blood work. We will go check in with him right now. Thanks both for your time.
Great.
Good luck to you.
Thank you.
Notice how she didn't ask about any test results or anything?
Oh,
Yeah.
yeah.
That's because on some level she knows the truth.
So what are we looking at?
I don't know, Reese, what are we looking at?
Well, no grandiose delusions or other signs of underlying psychiatric illness, so I think we can rule out psychosis.
Then how is this even possible?
Well, in a lot of cases, the anxiety produces a hormonal reaction, causes all of the physical signs of pregnancy without a growing fetus.
But we need to figure out why having a baby is so important to her.
Or, more specifically, why being pregnant is so important to her.
Right.
So what do we do now?
I see no value in withholding this from them any longer. So, what do you say, Doctor?
But you want me to break the news? Our bodies are complicated. Sometimes signals get crossed and our brains say one thing and our bodies hear something else.
I don't understand. Is there something wrong with the baby?
Yes, well, not exactly. It's complicated.
What exactly are you saying? Is there someone here who can actually explain to us what's going on, please?
If you give Dr. Reese a minute, I think you'll find that she has an excellent grasp of...
So, go ahead. Explain, Dr. Reese.
I am sorry, but there is no baby.
We lost the baby?
No, you never had one.
You don't know what you're talking about.
No, see, the evidence is actually right here. You have a condition called pseudocyesis. You may have heard it referred to as a hysterical pregnancy.
Are you saying my wife is crazy?
No, she's not. She's not saying that at all. She's saying that sometimes the mind has the ability to play tricks on the body.
I can feel my baby. I don't care what this ultrasound shows. Your machine must be broken.
I can assure you it's not. Your blood test confirmed.
Well, then your lab's broken too, 'cause I'm pregnant. I am!
Honey.
No!
Hey, back off!
No!
Honey!
No!
Honey! No! Get away from her!
Help in here!
I don't know. No!
Hey! Hey!
No, we're not waiving the contingencies. No. Oh, let me call you right back. I got another doctor in here.
Hi, Miss Green. I'm Dr. Manning. Can you tell me what happened?
I hit a patch of black ice, driving too fast. My daughter had another meltdown at school. Got pulled out of a meeting to go pick her up. Again.
Hello. What's your name?
Ariel, a girl who has zero appreciation for what it's like to be in her mother's shoes. No wonder I have an ulcer.
An ulcer?
Nothing Tums can't manage. Look, can we make this quick? I'm super deep in the weeds today.
Sure. Let me take a look.
Ah.
Sorry.
Ow. Okay. You okay, Ariel? Did you get hurt in the crash too?
She's been complaining like this for months. I've taken her to every GI specialist in the city at considerable expense. No one can find anything wrong with her.
It's not my stomach this time, Mom. It's my head.
It's throbbing.
Now she's got a headache. I think she's trying to imitate me, some juvenile attempt to mock her mother.
Okay, Laura, I would like plastics to come down and sew you up so that you get the best cosmetic result, okay?
I really do have to get back to work.
I will try my best to expedite things. But since you're already here, perhaps I can take a look at your daughter?
Yeah, that's fine.
Okay.
CJ, sorry, where were we?
I'm not just making this up.
Leg okay?
All of a sudden, my knee hurts. This place freaks me out even worse than school.
What freaks you out about school?
Everything. There's so much drama. It makes me crazy anxious. Sometimes I hide, sometimes I get into fights.
That's what happened today.
I looked up schizophrenia online. It says it can start in late adolescence.
Not usually as early as 14, but I mean, are you hearing or seeing things that other people aren't?
No, but sometimes it's like my feelings aren't my own. Like they're someone else's. You think I'm crazy?
Not really my favorite word, but no, I don't.
I'm gonna be working late tonight, but Ma will stay with you until then. Don't even think about using this as an excuse not to do your homework.
Watch his airway.
Seriously, Ariel, you've made your point. Stop putting on a show. Come. Ariel? Oh my God.
Ariel?
She's having a seizure.
No, I don't think so. There's no nystagmus and her muscle movements are not asynchronous.
Then what is wrong with her?
We need to isolate her.
What?
She needs to be isolated now. I need an empty room now. How we doing?
Okay.
How's that knee doing?
It feels fine, actually.
What if I told you that that was because I just took an Advil?
I don't understand. Ow! Why'd you do that?
I feel like I just slapped you?
Yes!
I'm sorry.
I don't like this game. I don't understand. Ow! Why'd you do that?
I feel like I just slapped you?
Yes!
I'm sorry.
What were you doing to my daughter?
I was trying to confirm a diagnosis. I want neurology to run some tests, but based on this and Ariel's history, I think that she has a condition called mirror touch synesthesia.
What?
It's a condition that causes her to experience the physical sensations and emotions of the people that she's interacting with as her own. My left knee hurts. Ariel feels it in her right. I slap my right cheek. She feels like her left is being slapped. She's mirroring me.
Her stomach, she's responding to your ulcer, not imitating you. She's literally feeling your pain.
Who ever heard of such a thing?
It's a pretty recent discovery, the existence of these mirror neurons.
Is there a cure?
Not yet, but there are coping strategies we can teach her to help her manage her condition.
I'm sorry. I have to get this. Yeah.
I cannot believe this woman.
How's that old saying go? You can lead a horse to water, but you can't make it gaze at its own reflection.
It's a cylinder. It's shiny.
Sorry to interrupt.
Not at all. We're just doing a visualization exercise. Okay, close your eyes again, Ariel. And do you see your shield? Okay. Now keep describing it to me.
It's gold. It surrounds me. It protects me from other people's pain and emotions.
Okay, keep seeing your shield. Now open your eyes. What happens when I do this?
Feels like you're touching my arm still. The shield's not working.
Visualization is a skill. It takes practice. And just so you know, when I visualize my shield, and be warned, because I'm a total geek about this. Hey, Come on now. You're not allowed to get down on yourself. This is our very first run at this. You're doing great.
It's not that. I just got really sad. Don't know why. Will you excuse me? Sorry.
Okay, let's try it again. Close your eyes.
She can really feel the pain of everyone she sees.
Yes.
Oh, God. I can't imagine how hard this has been for her. I took her to every specialist. I did what the doctors told me to. I thought she was faking.
There's no way you could have known.
I am hurting my own daughter. How am I supposed to protect her from this if I'm part of the problem?
It won't be easy. But she feels what she sees. If she sees a happy person, she feels happiness. And if she sees someone who's constantly anxious, hey, parents here?
No, making calls outside. Looking for a new care facility.
Did you hear they want to keep the pregnancy?
Mm-hmm. When you can't talk, you don't get to say that.
Yeah, well, I don't think it's the right thing. Maggie? Did you see that?
Mm-hmm.
I know PVS patients do that, and it's just a reflex, but didn't it seem like there was more going on?
Wishful thinking.
Teresa, can you hear me? If you can hear me, please open your eyes. Teresa, if you can hear me, squeeze my hand.
My time at the vet farm, I've seen this a lot. Blinking, spasms, sudden jerks of movement. Never ends up meaning what you want it to.
Let's get a CT brain.
On a 5-year coma patient?
Just in case.
Hey, you discharging her?
Just finished the paperwork now.
Dr. Manning,
Yes.
your coma patient, given the abysmal treatment she received at that facility, I couldn't help but wonder what other ways they might have failed her, so I reviewed her history.
Did you find anything?
I'm afraid not, but I do have one question. What time of day did you perform that neuro exam?
Morning. Why?
Sometimes traumatic brain injuries results in a patient developing irregular sleep-wake circadian cycles, so it's possible Teresa's become nocturnal. I suggest we try the test again.
Great. Mr. and Mrs. Hazen, this is Dr. Abrams, Chief of Neurosurgery. Do you mind if we perform one more test on your daughter?
Well, the EMTs from our new facility are on their way.
It should just take a moment.
Teresa, if you can hear me, please open your eyes.
I've asked her that 1,000,000 times.
I know. Just bear with me a moment.
Teresa, if you can hear me, please move your eyes side to side.
I'm sorry. I finished Teresa's discharge. As soon as her transportation arrives,
Hold
we will
on.
get you.
There's a condition called locked-in syndrome. If your daughter has it, she'd be conscious, but she wouldn't be able to move her eyes side to side. She could, however, move them. Well, let's see. Teresa, I need you to move your eyes up and down for me, please. Up and down.
Did you see that?
What was that?
Teresa, if you can hear me, please move your eyes up and down again.
Oh my God. I don't understand. How did you wake her from the coma?
I didn't, but I don't believe she ever was in a coma.
What?
We need more tests to be certain, but it's my opinion that her accident caused a stroke to the brainstem, which occluded the basilar artery.
What does that mean?
The stroke left her completely paralyzed, but still conscious. Locked-in syndrome. She's awake, but locked in her body.
All these years? She's always been awake?
Yes.
She heard everything we said. I said.
And she was conscious? While some monster assaulted her?
Oh, my poor baby.
I know, it's so terrible. I'm so sorry. But at least you haven't lost her.
It's possible that some of her paralysis is the result of spasticity, and it's therefore treatable with muscle relaxants and physical therapy.
Will she get better?
She'll never be fully functional, but she should regain some movement.
We can also order an infrared eye tracking device that'll allow Teresa to communicate through a computer.
Communicate?
And she'll be able to put together words and sentences.
You'll be able to have a conversation with your daughter again.
A conversation? With my little girl?
Thank you.
We'll give you time alone with your daughter now. Thank you.
Excuse me. Sean Adams, former naval aviator, now flies for a private charter company. He was doing his pre-flight check and felt faint. Co-pilot brought him in. Says it's not the first time. Now I checked Mr. Adams out. Can't find anything wrong. Probably just dehydrated and overworked. Says he feels fine, wants to go.
So why are we here?
Charter company wants a psych evaluation.
Uh-huh. Co-pilot says he's also been acting different. Doesn't go out with the boys anymore, naps a lot. Seems to be low energy, huh?
Sounds like depression.
Possibly.
In any case, the company won't let him fly till you sign off.
Why don't we have a little chat?
Thanks.
Just seems like everyone's overreacting.
But you can see their point of view. I mean, people put their lives in your hands.
And I'm fine. I've answered your question. I know what today is. I know where I am.
Aside from lack of energy, your co-pilot says that at times you seem mildly confused.
I have no idea what he's talking about. Maybe he's the one that's confused.
Mr. Adams, I imagine there's a lot of pressure at your job.
I used to land F-14s on an aircraft carrier. That's pressure.
Have you ever had thoughts of hurting yourself?
What? No.
Let's see here. Are you on any medication?
You mean, do I take anything that might affect my performance? No. I take a statin like 10 million other Americans. And no, I don't drink, if that's your next question.
All right, Mr. Adams. Well, thank you for your time. Getting, a little ahead of yourself, don't you think?
Well, he is exhibiting signs of depression, and there is a high rate of suicide among pilots.
Dr. Reese, trust me, I understand what's on your mind, but suicidality should not necessarily be a default diagnosis.
So what do you think?
I think that Mr. Adams is linear, lucid. I mean, he's certainly not confused.
Are you gonna sign off on him?
Well, I didn't say that. I mean, I thought he was a little defensive around the medication issue.
Well, the man has to prove himself to keep his job. That would make me defensive.
And you know what? That could be all there is to it. But look, he's a pilot. Let's just take the extra step. You know, run a tox screen, make sure he's clean.
Okay.
So, Mr. Adams, as part of our evaluation, we run a toxicology screen, and I'm happy to say that yours was normal.
I told you I don't take drugs.
However, we did find something else. Profound anemia.
Anemia?
It could explain your feeling faint.
Okay, I guess I gotta eat more steak.
It's actually more serious than that. We need to transfuse you with several units of blood right away. We also need to find out what's causing it, so I'd like to admit you for a battery scans and tests.
I've got my own doctor. I'll make an appointment with him.
Mr. Adams, we don't want you to leave in this condition. You're not well.
I feel fine.
Sean, are you sure about that?
Yes. And a car ride home and sleeping in my own bed isn't gonna hurt me.
That may not be true. I emphatically recommend that you take Dr. Choi's advice.
As far as the psych evaluation goes, am I in the clear?
Well, not listening to your physician isn't the greatest sign to me.
Well, you're not the only psychiatrist in Chicago. I'll get a referral for my primary.
Sean.
Viv, we're going. Hand me my clothes. Please get me whatever paperwork I need to sign so I can get out of here.
Be back shortly.
Sean, oh my God. Oh my God. Help, someone! Help! My husband, please. Okay, hey, I need a gurney here.
Whoa!
You.
Can you hear
What's
me?
wrong with him?
Unresponsive, has a pulse. Get him in a room.
Bring it over here.
Transfer on my count. Ready? 1, 2, 3.
Here we go.
He's not breathing. Give me a laryngoscope and a 7.5 ET2.
I got it. Sean! Tell me when to prep.
We'll take care of him. Totally flaccid. Don't need drugs.
Monique,
Right?
you start the IV.
Okay. Okay, you stand right here.
He's got a massive upper GI bleed. His stomach's filling with blood.
What's the blood thing?
I'm in. April, listen to his lungs.
Yep. Good breath sounds bilaterally.
All right, hang 2 units of blood and get another 4 ready.
What's going on? Why is this happening?
I don't know, but we're gonna find out.
Hang saline. Saling's up. All right, stay on it.
Huge gastric ulcer. That's where all the blood was coming from.
Were you able to stop the bleed?
Yeah, GI cauterized it, but that's not the headline. Sean's endoscopy shows chronic caustic esophageal erosions. And his chest x-ray.
Pneumonitis.
Yeah. This is a pattern suggestive of ingesting some sort of hydrocarbon.
Isn't that in cleaning products?
And lighter fluid, motor oil, gasoline. Extremely toxic. So we must be talking about low doses over a long period of time.
So, I was right. We should be concerned he's suicidal.
Well, I assume he's doing this to himself.
Well, what, you think someone's poisoning him?
I don't know. It's possible. I had a case where a wife was slipping something into her husband's food.
So you think it's his wife?
You know, hydrocarbons are extremely noxious, so he would have smelled it.
Not necessarily. They're all over any aircraft hangar. With constant exposure, you could be noseblind.
I don't know. Suicide? Attempted murder? I think it might be something else altogether. Mr. Adams, can I ask you, you ever find yourself doing something that you know you shouldn't, but you just can't stop?
I have no idea what you're talking about. My wife would say that I watch too much football.
I tell you my dirty little secret. I went through this phase where I would come home every night, cut my nails every night, like down to the quick. Couldn't stop. It sounded like I must have been satisfying some urge, but my hands were bleeding. Wasn't good.
And the point of this?
The point is that I understand compulsive behavior. You know, it's not rational. You can't explain it. You just do it. Yeah, but eventually, like with me, your fingers bleed or something similar. You know, it just starts to cost you too much. And you want to stop. You realize that it's interfering with your life and you just really, really want to stop. Sean, I think you have a compulsion. And you're tired. And you're also getting scared. I mean, who wouldn't be scared? All that blood, all that vomiting?
Yes. I'm tired.
Mr. Adams, we think you're ingesting something very harmful. Can you tell us what it is? Mr. Adams, please, we can help you.
Gasoline.
I'm sorry, say again?
I drink gasoline.
Is my husband crazy? Why would anyone drink gasoline?
I know it's very difficult to fathom, But I'm quite sure that your husband is suffering from a psychiatric disorder known as pica, which involves the compulsive consumption of non-nutritive and sometimes even hazardous substances.
For some, it's paint chips. For others, dirt. For your husband, it's gasoline. Why?
There's no unified theory as to the cause. All we know is that it manifests itself as a compulsion, an irresistible urge against one's conscious wishes.
Can he stop?
Probably not on his own, but if he'll allow us, we can help him.
Okay. We'll do whatever it takes to get him healthy.
Before we discuss the course of psychotherapy, I'd like to talk to you and your husband about repairing the physical damage.
Of course. He could have killed himself. Sometimes we're gonna win, right?
Sometimes we gotta win.